Welcome to our Obstetric Bedside Ultrasound curriculum. We've collected some of our favorite videos about fetal biometry. Learning objective number 1 is to identify the anatomic landmarks necessary for correctly measuring fetal biometry. Learning objective 2 is to describe correct caliper placement, which is critical for obtaining accurate measurements. A caliper is the ultrasound tool used to make measurements on your images and can be a line or a circle, called an ellipse. Ultrasound can be used to take measurements of fetal anatomy to estimate the fetal weight and gestational age. These measurements are obtained by finding very specific views of the fetal head, abdomen, and lower extremity in order to complete a mathematical formula called Hadlocks to calculate an estimated fetal weight. Most ultrasound machines will do these calculations for you and generate a report. We use two measurements of the fetal head called the biparietal diameter and the head circumference. To get these measurements, obtain a transverse view of the head with the following anatomic landmarks in view: the thalami, cavum septum pellucidum, and falx cerebri. This is called a transthalamic view. You can also see the third ventricle, choroid plexus, and insula in this plane. For biparietal diameter, your caliper should be placed from the outer edge of the parietal bone to the inner edge, from outer to inner. For head circumference, your ellipse should follow the outer edge of the bone and should not include skin or subcutaneous tissue. Here are some imaging pearls. First, identifying key landmarks is critical to make sure you're in the correct plane. For BPD and head circumference, you need a transthalamic view, which is marked in the green box with the thalami, CSP, and falx clearly visible. If you're missing landmarks, you may be in an incorrect plane, like plane A, which is a transventricular view, where you see the CSP but are missing the thalami. This would result in an inaccurate measurement. Pearl number 2. Let's zoom in on those calipers. For BPD, the caliper should be placed from the outer edge of the parietal bone to the inner edge. Next, let's look at measuring the abdominal circumference. This is a transverse view of the fetal abdomen with key landmarks including the umbilical vein, stomach, spine, and fetal ribs on each side laterally. The caliper used to measure the abdominal circumference is an ellipse, which should be placed along the outer edge of the skin. Let's go over some pearls for measuring the abdominal circumference. Remember, this is a transverse view, which is also called an axial view of the abdomen. To ensure you're truly transverse, there should only be one rib visible on each side of the fetal abdomen. If you see fetal kidneys in the view, you're too low or too caudal on the fetal body. To correct this, adjust by sweeping towards the fetal head to obtain the necessary landmarks. Remember, sweeping means to move the probe along its broad axis, which is marked by the blue line. Sweeping will show you serial transverse views of the fetal body. Similarly, if you see the cardiac axis or if the fetal heartbeat is visible in the view, then your probe is located too high or cephalad on the fetal body. To correct this, sweep caudally to identify the correct landmarks. The femur length should show the whole diaphysis with calipers placed at each ossified end of the diaphysis. The femur should appear horizontal on the ultrasound screen to be accurately measured. To make the femur appear horizontal, remember to dip and slide. The fetal bladder is a great landmark to aid in finding the femur on ultrasound. Identify the fetal bladder in a transverse view. Rotate the probe 90 degrees, then move the probe superiorly and the femur should come into view. This was lesson 3 of our obstetric bedside ultrasound curriculum. We went over 2 learning objectives on performing fetal biometry. We reviewed the key anatomic landmarks for each biometric component and how to correctly place calipers to get accurate measurements for estimated fetal weight. A summary table with anatomic landmarks and caliper placements is here for your review. For the full-length videos featured today and more awesome ultrasound content, check out our references.